Kaleidoscope, a weekly public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and News Channel 5.
Hello, everyone, and welcome to the broadcast today. The Cleveland Clinic Stephanie Tubbs Jones Health Center and the Cleveland Clinic Health and Education Center at Langston Hughes offer a wide range of health care services. We'll hear from Jacqueline Adams, who is the Community Outreach Coordinator for the Cleveland Clinic Stephanie Tubbs Jones Health Center, and Michelle BERKLEY Brown, a certified nurse practitioner with the Cleveland Clinic Health and Education Center at Langston Hughes. Then the administrator of the Department of Children and Family Services, Patricia Rideout, will talk about the need for adoptive families in Cuyahoga County. And later in the broadcast, the president of the National Urban League, MORIAL, will talk with me about his perspective on the state of the economy in the United States. Good morning, everyone. I'm Leon Bibb. This is Kaleidoscope, and so we begin. Beginning with Jacqueline Adams for the Cleveland Clinic Stephanie Tubbs Jones Health Center, and Michelle BERKLEY Brown of the Cleveland Clinic Health and Education Center at Langston Hughes. Good to have you both with us.
Thank you.
Yeah. Tell me, Jacqueline, let's begin with you. The Cleveland Clinic recently opened the Stephanie Tubbs Jones Center in East Cleveland. Tell us about this facility and what it does.
Well, the Cleveland Clinic Stephanie Tubbs Jones Health Center primarily is a center that focuses on diabetes. That was our niche at the former hospital, and we've continued that outreach at the center. Also hypertension, kidney failure, mental health, quite a few specialties at the center. Women's and children's care, as well as primary preventive care. What's new at the center that's privy at the new Stephanie Tubbs Health Center is the Navigation Center. And the Navigation Center, the primary focus of this is trying to delineate barriers that patients may encounter as they come into the center. And that could be from social aspects or non-social aspects. Also, we do provide free transportation to within a 5-mile radius from the health center, as well as shuttle services to the other hospitals, such as Hillcrest, South Point, Euclid, and the main campus.
Things are working out very well for you.
They're working out.
Let's bring Michelle then. Michelle BERKLEY Brown is with the Cleveland Clinic Health and Education Center at Langston Hughes. Tell us about your facility. You're located at East 79th and Quincy.
East 79th and Quincy, and we are there to really empower individuals in the community to take better care of themselves. We have health and wellness programs that address the community health needs and really focusing on those individuals who have chronic illnesses and also preventing a lot of the illnesses. Some of our key programs are an exercise program twice a week that's free to the community, and really bringing exercise programs, nutrition programs, and helping individuals learn how to really take care of themselves and developing health practices that promote health and well-being in the community.
So a lot of emphasis is on preventative things. Let's fix some of these health problems before they get to be problems.
Absolutely.
That's what you're trying to do there.
Absolutely, because we know that if we can help people be active, quit smoking, and learn how to eat healthier, that we can prevent a lot of illnesses and a lot of chronic diseases in our community.
Jacqueline Adams, that's pretty much the same emphasis at the Stephanie Tubbs Jones facility, located right there in East Cleveland.
In East Cleveland, and we deal with so many of the similar barriers, as Michelle stated. Prevention is huge, and if we can really reach out to the community and encourage them to begin to look at their overall health care in terms of what they're putting in their system and how they're maintaining and their lifestyle, this can ward off so many medical conditions.
You had mentioned diabetes a few minutes ago.
Yes.
That's running rampant through America, isn't
it? Running rampant. The numbers are huge, and especially in the African-American community. And that's one reason why we have always focused on diabetes. We have the Diabetes Center, which is a referral program from your physician. There's a course that you take with our diabetes nurse educators team, and they specifically work with the patient to try and work with them so that they will be able to maintain a lifestyle even though they are diabetic.
Michelle, you deal with the similar kinds of things. You mentioned diabetes over at your facility, the Langston Hughes facility.
Absolutely. We provide screenings for diabetes and hypertension, as well as STDs, including HIV. So we're really helping to identify, early identification, and then connecting those individuals to places like the Stephanie Tubbs Jones.
Are we making a dent in health care, getting people acclimated to to going to the doctor, even beginning there?
Yes, we are. We are definitely doing that because I think it's important that they understand the importance of routine doctor visits. So preventive care or well care versus sick care, because for so many years we have focused on medicine as a treatment for illness, a treatment for injuries, and what happens, what do you do when you get ill? But we're trying to change the way of thinking into well care. So what do you do to keep from being unhealthy? So exercise, eat healthy, quit smoking, learn about your medications, learn about your disease, learn how to communicate with your doctors, and that's what we're empowering the community to do.
We got about a minute remaining. Things are going well. Your facility is a brand new facility.
It's a brand
Once
new
Huron
facility.
Hospital closed down at the foot of the hill there, right at the corner of Holyoke, if memory serves me correct, Holyoke and Euclid Avenue in East Cleveland is the new Stephanie Tubbs.
Well, no, Belmore and Euclid. Belmore and Euclid. The hospital was on Terrace, and we're off of Belmore and Euclid Avenue.
And things are going well.
They're going very well, and we have many preventive service programs as well. I just want to mention our free mammogram Mondays program, in which women can come in and receive a free mammogram, as well as our Day for You program, where they can receive a free pap and pelvic through our county partnership with the BCC Breast and Cervical Cancer Program through the county, and a mammogram at the clinic as well. So we're doing a number of preventive service programs too.
Michelle, you leave us with a final thought on why this is so vital and so important.
This is so important because we do not have to die prematurely from things like diabetes and high blood pressure. And if you take charge of your health, you can live a longer, healthier life, and that's why it's important.
And that's the name of that song. We're trying to live as long as we can, as well as we can. Okay, thank you so much, Jacqueline Adams, who's with the Cleveland Clinic Stephanie Tubbs Jones Health Center, and Michelle Berkley Brown, who's with the Cleveland Clinic Health and Education Center at Langston Hughes. Good to have you both on the broadcast.
Thank you.
Okay. I'm going to take a break. I'll be right back in just a moment. We're going to take a few words out, and we're going to talk with Patricia Rideout, Administrator for the Department of Children and Family Services, after this. Welcome back to more of Kaleidoscope. Good to have you with us today. There is always a group of children in Cuyahoga County waiting to be adopted. Administrator for the Department of Children and Family Services, Pat Rideout, is here to talk more about the need for adoptive parents, and she'll talk about the requirements for potential parents. Good to have you with us, Pat Rideout.
Thank you.
Yeah, Administrator for Department of Children and Family Services. Things are going well there?
Yes, they are. Thanks.
Oh, good for you. Good for you. How many children are out there currently waiting for a family in Cuyahoga County?
Today we have 608 children who are legally free for adoption and waiting to find that family.
And they want to get connected with a good family, right?
Absolutely.
So what do you tell people? What do you tell potential adoptive families?
Well, we tell them that we believe so strongly in the need for children to grow up in a family setting, that kids really need families, and they need permanent, legally secure families, not just now, in the time before they turn 18, but for life. And I think with Thanksgiving coming, this is a time for us to think about that families are with us throughout our lives and not only in our childhood.
What about the demographics? Can you speak to the demographics of what we're talking about?
Sure. Our children who are available for adoption range from very young to 18 years of age, and about half of them are 12 and up. And I think that's a population we don't often think about. But our older kids need families as well as our little ones. About 2/3 of our children in this county who are waiting to be adopted are African American. And I think that's a good profile, yeah.
What's it take to be an adoptive parent? What kind of person are you looking for?
We are looking for loving adults who really want to make a permanent home for a child. They can be of almost any age. They needn't be married. They can be couples or singles. We just really need people 18 and over who are willing to provide a family for a child.
You've seen success stories with all of these over the years.
Yes.
You've been in this business a long time. You've seen. What is it that happens when a child who's looking for an adoptive home gets adopted by that individual or by that family?
I think for many of our children who have experienced hardship before they find that forever family, that sense of security, of belonging, of having a connection that will last them for the rest of their lives is a very critical piece in the building blocks of a successful adulthood. And so really it's mostly about people who have big hearts and can open them and really want to play that role and expand and build a family. That's all we really need.
You mentioned the phrase big hearts. Let me ask you, what's the Moving Hearts Gallery?
Yeah. The Moving Hearts Gallery is really a wonderful recruitment mechanism that we use. We have beautiful photographs of our children who are waiting for a family, and they are exhibited around the community in a variety of locations so that folks can get a sense of who our kids are. And right now, the exhibit can be found both at Karamu House and at the Lakewood Public Library.
Somebody out there is probably saying, well, maybe I can do this. Maybe there is room in my heart. Maybe there is room in my home for an adoptive youngster. What's the first step?
The first step is to contact us. We have a recruitment line that may be on screen. I'm not sure.
We'll put it on. Is that the 881-5775?
That's the number
that I've been given. 216-881-5775. Or you can also go to cfs.cuyahoga-county.us and get more information on everything we've been talking about. So if somebody makes that phone call, what happens after that?
So there will be a process. There's pre-service training to begin, which is an opportunity for people interested in adoption to learn more about what it's like to take in a child and what some of the attachment and bonding issues might be like, as well as to learn more about our process. It takes 36 hours in the state of Ohio to become a licensed adoptive parent. So when an application is then completed, we have social workers who conduct what we call a home study, come out and spend time with the adoptive family, and that home then is hopefully eventually approved, that family is approved, and then the process of finding the right children for that family begins. And I say the word children because many of our kids do have siblings, and we want them to be adopted together.
You'd like to keep that family, brother, sister, brother, brother, sister, sister. You'd like to keep them together.
Exactly. That is often our longest lifetime connection is to our siblings.
Certainly.
Yes.
What if somebody says, I'm not certain I want to adopt? Can I come in and just kind of try some things on, talk a little bit? Or is there something I can do short of adoption?
There are many, many ways in which people can support our kids. In addition to our legally free children, we have a couple thousand kids who need foster homes. And many adoptive parents begin by fostering children who may not eventually return to their families, though most do. And that gives them an opportunity to find out how it feels. And so fostering is one way to enter this system. We also have lots of opportunities for folks to come in, for example, and mentor children. And mentoring our older kids is particularly important. And so we have a number of partners who we work with, Adoption Network of Cleveland, Beachbrook, places like that, who run mentoring programs where you could get hooked up with a young person who really needs a mentor.
So we're going to ask people to make that phone call. Pat Rideout says, call us. Give us a call at 216-881-5775, or you can go to cfs.cuyahoga-county.us and you can get more information on everything we've been talking about. Many thanks, Pat Rideout.
Thank you so much.
Thank you for what you do.
Thank you.
And for the children, too.
Thanks.
Okay. I'm going to take a break. I'll be right back in a moment. We'll hear from Mark MORIAL, the national president of the Urban League. Back in a moment. Welcome back to Kaleidoscope today. A sluggish economy and the need to get jobless Americans back to work is just one of the many things on the agenda of the National Urban League. Its president, Mark MORIAL, is here with me this morning, and he's going to share more of his thoughts about that. Good to see you, Mark MORIAL.
Great to be with you, Leon. Good to be in Cleveland.
Yeah, good to see you.
Yeah.
Coming in from New York now, national headquarters.
Yes, and here to be a part of the work that the Cleveland Urban League and Marsha Maccabee are doing. They're big Equal Opportunity Day luncheon, and pleased to have been able to speak at that event.
Yeah. You've been talking about some of the top priorities in this country. From the National Urban League's perspective, what's number one?
It's simple. It's jobs. And then, Leon, number two, jobs. Number three, jobs. Jobs are the #1 issue facing the nation, the #1 issue facing Ohio and Cleveland and every city across the nation, with 14 million Americans out of work, with deep unemployment in urban communities. Nothing is more important than to do everything possible to create jobs. Whose responsibility is it? Everyone's. It's the mayors, it's the governors, it's the responsibility of every business leader to do whatever we can to put more people back to work.
You've been dealing with this for years now. You're the former mayor of New Orleans, living in New York now. But when you were mayor of New Orleans, you were dealing with this urban consideration.
And in the 90s, when I had a chance to lead New Orleans, we cut the unemployment rate in half. It was a very different time, but there was expansion in the city's major industries: tourism, the port and international trade, healthcare and the hospital sector. All of those things expanded. We did new things in technology. We did new things in the film and video business. And I think now, as a nation, we commend that President Obama has put a jobs plan on the table. The National Urban League has promulgated and promoted for the last year and a half its own jobs plan, this 12-point jobs plan that people can go to the internet and take a look at. Here in Ohio, I'm pleased to be working with Senators Turner and Kearney, two members of the Ohio State Senate, who put together the Forward Ohio Plan, which is a plan to create jobs, a piece of legislation now pending in the Ohio legislature. So we're supporting all of those efforts, and it is about investing in people to give them the skills and the training that they need, creating capital for small businesses and opportunities for small businesses, and it's also about building infrastructure in a way that puts people back to work.
As you talk about your 12-point plan, back to work, by the way, it's called Back to Work, and people can, I'm certain, can get this if they
yes, IamEmpowered.com or NUL.org. Those are two websites.
You can get a copy of this. But as you talk about this, are you optimistic? Do you see hope on the horizon?
I am optimistic. The economy is slowly beginning to grow, but the growth in the economy is now being offset by layoffs in city governments, state governments, school districts, and we've got to resist as a nation sort of this impulse that we need to cut these domestic programs that produce jobs for people. So while Congress debates a fiscal plan, we are saying do not unduly burden, do not force the most vulnerable Americans to pay the biggest costs for the nation to have a fiscal plan. So I am optimistic, but I do not think that across the nation we have enough of a sense of urgency, enough of a sense that something needs to get done now. It's been difficult in Washington, for example, to even get the Senate to cast an up or down vote on the president's jobs plan. That's one example. Here in Ohio, we certainly hope that the Forward Ohio plan is going to have a fair hearing and an up or down vote in the Ohio state legislature.
I've got 2 minutes remaining. Do you sense that the Congress and the White House, the Democrats and the Republicans, can find a way to settle some of the issues that they've been dealing with to fix this whole thing?
I think if people discontinue posturing and if they put people and jobs first, not seek to score political points, what I'm confident of is that they'll take strong steps. The first step I think they should do is have an up or down vote on President Obama's American Jobs Act. Up or down, not filibuster it, not try to cut it into pieces, but have an up or down vote on the whole package. The president's responsibility is to propose. He's done so. The Congress's responsibility is to dispose or vote up or down on it.
You've met with the president, certainly at the White House, over the
last 18 months, strongly encouraged him to put a jobs plan together. He did. We shared our recommendations with him. He included a number of our recommendations in his plan, and we're going to continue to push him and his administration and the Congress. But right now, he's done the right thing. He's put a plan on the table, and what you need is a plan that people can rally around, a plan that people can vote on. So I'm saying certainly that it's important today that Congress have the same sense of urgency as the pain of people in communities like Cleveland and Akron, communities communities like Canton, communities here in northeastern Ohio, but communities all across the nation who, when I visit, say we need jobs and we need them now.
I've got 30 seconds remaining. In your 100 years, the National Urban League's 100 years, or thereabouts, this is always what has pushed, hasn't it?
Economic empowerment, jobs, economic independence, and sustainability. We are the economics civil rights organization. We're about economic empowerment. We're going to continue to voice that. And I'm here in Ohio as a part of our Ohio Jobs Tour, which is one part of a national jobs tour in Cleveland and in Canton. And I'll be back many times in 2012.
We will look forward to you.
Thank you.
Good to see you, Mark Morial.
Thanks. My pleasure, Leon.
National President of the National Urban League. Good to have you on the broadcast. I'm going to take a break. I'll be right back. We'll talk to Marsha Maccabee of the Urban League of Greater Cleveland right after this. We're back with more of Kaleidoscope. Good to have you with us, and we're joined right now by Marsha Maccabee of the Greater Urban League of Greater Cleveland, and she's one of our partners on this broadcast. We just finished talking to the national president.
We certainly did, and we're certainly pleased to have him with us today for all the celebration of our Equal Opportunity Day luncheon that occurred, and all of the great work that's happening on the national front. And you heard him talk about jobs, 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 and the importance of jobs. And what I want to talk about is here locally, how we're mirroring that urgency. There's a sense of urgency about what has to be done in our community, and I think what you're going to see, I know what you're going to see over the next year from the Urban League is really us stepping up to the plate around a sense of urgency about that.
How do you get that point across, the urgency?
The urgency.
Or is that point already across?
Well, I think you do it two ways, Leon. Certainly by talking about it, but I think we have to also be about it, be about putting some action behind it. And so I think in terms of being a strong advocate, putting programs in place, putting services in place that actually can help people to get to the jobs is what's going to really be critical, and that's what we're going to be focused on.
We've been reporting on some businesses have begun to increase their employee numbers.
Absolutely.
Certainly in Lorraine, there's a steel plant that is going to expand with a big arc electric furnace. They're taking scrap steel and making more steel out of that and adding hundreds of jobs. That's the kind of thing we need to see. Do you think that other companies are getting on board, seeing where they can hire more employees?
I certainly do. I certainly do think that. But the other side of that equation is making sure that there's a trained workforce that have the skills that can move into those jobs.
So we got to make sure that the school systems stay viable and strong.
Absolutely. Absolutely. And we're working with the school system. We're working with institutions like Tri-C. We're working with various contractors in the construction field and everywhere we can.
That's going to have to do it for us. Time is taking it away. That's going to do it. We'll say so long.
Kaleidoscope, a weekly public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and News Channel 5.